I'm getting Bourbon for training bow. First, I'll check him over, look at the saddle. Luckily, it hasn't been bought yet. So everything's still open in case it doesn't fit. I think that's really good. Yeah, and then I'd like to take him on the lunge, or rather the double lunge, just to see how we'll both work together over the next few days. Hey, Burbie. Are your ears all perked up? Yeah? Whoopsie. Oh, Vicky made you look so nice back there. Yeah. Wah, wah. Good, right? Do you want to come along? Yeah? Do you want to come along? Yeah. Look here. You're doing great. Oh, what did you do to your blanket? It's open in the front. Look here. Yummy, 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 yeah? Yeah. Good boy. Nice. So come here. Whoopsie. So come on out with me. Come on. Yeah. We'll come back in on the other side, Falco. Look through the window. You'll see us in a bit, okay? Come here. Come on, you big guy. That's it. Come on. That's nice. Oh, look at those chubby cheeks. Yeah. You have to listen to me too, okay? Don't just stomp off. Yeah, Bourbon was actually only very recently gelded, just a short time ago. So he's still adjusting to the change. And I think he needs a bit of leading training too. Fine. Well done. Great. Come on. Oh, great. Wonderful. Super. Come here. Excellent. Come here. Come on. Look at that. So, come along. Yeah, the problem with Bourbon is that his back left kneecap pops out quite often. You can see it especially when he turns like that on the spot. He's actually here for muscle building training. Falco, you can stay completely relaxed. Yeah, what I already noticed with Bourbon this morning when Vicky was grooming him nicely, I already noticed that he really likes being scratched up here on his forehead and also really just below the ears. He finds that really great. He relaxes more. No. All right, stay still. Let's take a look. So the first thing I do is check to see if the hooves are actually the same size. If one might be smaller, narrower, if the walls look even. So, wait, so I don't get a false impression. Now I'll lead him forward and have him stand again because it looks a bit strange on the front left now. So, it could just be a coincidence, of course. Take a step back again, just a small one, and another step. Now, whoa, super, great, excellent. Good boy. Yes, sweetie. Just stay still for a moment. It's all good. We need to give Bjorn a little medical attention. He twisted one of his shoes in the back. We just took it off for a moment. Now it's a bit more comfortable. So let's keep going, right? Show me your little teeth. He doesn't like that very much. That's it. Look, I just want to see. Yeah, I just want to see. It's annoying, isn't it? So he's 5, which means it's quite possible that there are 1 or 2 caps on there, which are naturally painful. It's okay. I can't feel that, however. So there's a canine tooth. Yes,
That's it.
Chongbi. So what you can also always see quite well is if, for example, there's a small rash like this on the gums. That's not the case. There's a bit of tartar here. Don't eat my finger. So, yes, yes. Look at that. Great, right? Yes, 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 yes. So visually, there's no wolf tooth there either. How's it on this side? Can I look there too? Yes. You're such a good boy. For a 5-year-old, you're so good. Yes, just don't bite my finger. So this is quite interesting now. On the other side, this single tooth on top is relatively large, so normal. And on this side here, I'll see if he lets me stay there longer. It's very, very sharp there. It's very small, but very sharp. Ask the dentist if it can stay like that, right? Or if it has to come out. It's prickly, isn't it? It's all good. So look here. Can I touch your first molars without you biting me? You're going to start chewing like crazy, aren't you? So the first one is already sharp. So I'm just going to go up the cheekbone, the chewing ridge, stay right here. So it's already a little bit swollen here. Is it like that on the other side too? Yes. You like that, don't you? Yes. Good boy. Look here. So let's look at the pole. Jaw joints are not sensitive to pain. You like that, don't you? Yes, you like that. So the pole is straight. Yes, that's normal, huh? Yes, come here. Let's see. So, palpating the jawbones once. You're doing great. 5 years old, recently gelded. Such a well-behaved boy. That's really impressive, isn't it? You're a very fine one, yes. Yes, wait, stand still. What's going on with your crest? It's not nearly as tight as your buddies out there, is it? Yes, it's nice and loose. So now I have to tie you up for a moment, okay? You know this from this morning. Look, there comes your outer. That's nice. Good boy. Yes, just relax nicely, okay? It's all good. Yes, everything's fine. So, great. Oh, we actually had to take the shoe off his back, right? Because he twisted it once and it was really bothering him.
I'm glad when they're gone, to be honest. They'd already been on for 7 or 8 weeks anyway. That's great. I'm really glad they're gone. The bars? I weren't really convinced that's the best thing for him, so...
Fine. Great. You're doing great. Excellent. That's a good boy. Well done. That's nice. So what we have so far, the front teeth are already sharp. The molars, the first ones. Jaw joint is not sensitive to pain. Pole is straight. Excellent. Yeah, he really likes it right here.
He still has these ridges. They were even stronger when he was a stallion. I think that also has to do with the testosterone a bit. They lose muscle when the testosterone's gone. Yes.
Because that's really crazy. I just noticed that it's significantly more on this side than here.
It's already decreased.
And this is really, the bone runs along here and then...
Yes.
Okay.
Or because he's so friendly and always has his ears forward, so he always needs this muscle, you know?
Yes. So I'll see if he can be straightened up here. That's good. No, then I can also feel the spinous processes better if he comes up a bit here. Watch out. Great. You're doing a super job. Excellent. Good boy. Well done. Top notch. So I'll take a look at the shoulder blades to see if they're at the same height, like so. He needs to stand up straight here. Come here. You're sticking to the wall, aren't you? Yes, there you go. That's good. So it feels as if the right side is further down. Stay still. It's exciting back there too, isn't it? Yes. That's nice. Well done. So come here. Now let's see what your saddle says. Just a tiny bit more. Good. That's nice. Stay like that. Everything's fine. Stand nicely. Yes, stay standing nicely. Yes, it's all good. You're standing well like that too. Good. Well done. So what's really crazy, you can see it now. That the left side, specifically in the thigh area, is significantly more pronounced. Right. You can see very clearly that, especially in this area here. It's much, how he's standing on the other leg, so he has to move back over here, that it's much more pronounced here than on the other side.
The patella luxation is also always on the left, right?
Oh, Vicky did a nice job on the tail. Very nice. So now he's also standing wonderfully clean. So you can take a look for yourself in a moment. What is also clearly visible is that the right pelvic wing is much further down than the left one.
Oh my God, that beautiful tail.
So go right behind him. Everything's fine.
Yes, good. Oh, yes.
Right. And then you see that this is basically, the spine is much higher than on that side. That's
great.
He's standing squarely now.
Yes.
That's very clear. And if you look from right here, I don't usually like to stand directly behind, but if you trust your horse, you really can stand back there. And take these two pelvic bones in your hands, feel them, and then you'll notice that this bone is further forward than the one behind it.
True. Yes, absolutely clear. Yes, yes.
Right? Here. Good boy. This one's higher and this one's, that happens quite often. So that's when they, for example, go through the stall door and, for instance, get caught with an edge on the post, for example, or bump against it.
And he actually had that when I brought him to the new stable. After 2 or 3 days, he had a scratch right here.
Yeah.
Of course, that's gone now 4 weeks later, but there was a scratch there. I can confirm that. Because I always check him over, of course, to see if anything's anywhere, right?
So, for example, right, it's often the case that you lead them out and then, oh, it's too narrow, and then they get stuck.
Yes.
And then it really can be that one pelvic bone is then further back than the other.
Yes.
Oh, now the left side is obviously much further down. No, he's favoring it. Good boy. Great. Just stay standing for a moment. Excellent. That's also annoying, right? When you're always being watched like that. So, and what's also very clear is, kaboy, that this side here,
it's at most this high, right? That makes a big difference.
Well, no, not that much, right? You can also see that the muscles here, when you look from behind, this one is longer and also rounder. And this half here is shorter. Oh, yes. Even, oh, these tags are still on here.
Yes, exactly. Because as I said, it hasn't been paid for yet. I can still return it if although the saddler also told me that a lot can be done then. It's a very modern saddle that could still be adjusted in the tree and everywhere else. I don't know. How do you assess that then?
Well, let's take a look.
Come on, move over.
It doesn't matter. It's all good. Good boy. So come here. We're not doing anything, right?
I don't know myself. I've never had it on him myself.
We'll do this very carefully.
Sit it to him.
There, that's nice. So it's a brand new saddle. And was someone there and looked at him too?
Yes. However, that was on the very first day when he arrived at the clinic, before the castration. The muscles were certainly much better developed in the front then. Although I then thought to myself, ultimately, he should return to this muscle condition when he's being ridden again. He shouldn't stay as he is now, because right now he's not working at all. As I know from your many videos, that's not necessarily the criterion for whether the saddle fits well or not.
So back here, he doesn't have any pressure at all. That's a good start. I actually know from my own experience that Albion has always tended to have the center of gravity of the seat positioned very far back compared to most other saddles.
Okay.
Of course, I'm not familiar with the newer models. I just know that they were often too long for short horses. Yes, you're sitting almost exactly on the 18th.
Not so good.
That's really not so good. I almost thought as much. The saddles are comfortable, of course, and they're soft and they...
Exactly.
So if you now...
Yeah.
If you reach under the front now, it's actually quite airy there.
Okay.
Everywhere, even at the very top, doesn't have much contact.
Yeah.
Exactly. And if you reach under on the other side now, it really puts pressure on the shoulder blade.
Yes.
It does. That's the difference.
It's pinching here. In comparison.
So, and then there's also the fact that the dressage saddle shin.
It's the difference.
Yes.
It's unbelievable.
And then there's also the fact that the dressage saddle should actually leave the shoulders somewhat free.
Yes. Yes.
I'll show you why. I think it slipped back a bit again.
We had that with the big one, right? That for years is an exaggeration, but certainly for almost a year, he was ridden by the professional rider with a saddle that was much too narrow in the front, right?
Yes.
Yes, and we don't want that again.
And the problem is simply if you stand sideways now, really a bit towards the wall so that you can see it properly. If you go to the wall there, for example, so the reason why the shoulders should actually be free is that when the horse moves its leg forward in a trot or whatever, the shoulder blade rotates backwards.
Yes.
Yes. So if that's where the most pressure is, then he can't do that as well, of course.
Right, Tom.
And you're basically always blocking the movement, the shoulder freedom. So, and there are saddles. I mean, this one doesn't fit too badly, but it's just, he's young. If you really want something that fits properly, I'd say you need a saddle where the center of gravity of the seat is further forward.
Yeah. Okay.
Otherwise, you're sitting exactly on the segment where you're not actually supposed to sit.
Yeah.
So, and I think
I see it too when I stand here on the side. The center of gravity, the seat's center of gravity is definitely here.
So, and if you now follow the last rib up,
it should actually be more like here.
Further forward. But that's what I know from Albion, that they're just very far back, which of course offers the rider a lot of freedom. That's why they're also very popular, of course, and they're also very soft. And everything, that's nice, but I've always had it like this so far. I mean, I've had many who had Albion where it's really just too long. So, and here then, that would bother me now on a young horse that I'm really putting into work, that this is really hanging on the shoulder, right?
Yeah. Yes.
Again. So, exactly. And then you can compare the two sides again. Whoa, yeah, compare the two sides.
It's tight there too.
Not on the other side.
It's looser, exactly. It sits lighter, so.
Fine, good boy. You're a good boy. Yeah, the way it looks on him now, The saddle is crooked here because it basically pulls itself over into this position. Here, the saddle sits much further back on the shoulder than on the other side. And if you look from behind, you can also see it very clearly that it tilts over to the right, really pulls itself over a bit. I'm going to girth him up again now. He has 3 options. I'll use the front girth strap and the last strap first, just to see what happens then. For me personally, it doesn't make a difference because if I girth him now, the saddle basically just pulls itself down. And the spots that are already pressing more anyway, press even more into the muscles. Even if it then looks straight, it wouldn't be okay for me personally. So come here, now we have it loose for now. Yeah, now the whole picture actually looks even worse.
Yes. I think so too. From back here.
That's nice. Right, because here, well, for one thing, you can always change the gullet. I don't know if you can change the gullet itself in this saddle, or if you only do it by reflocking, so padding in and padding out. This saddle here should actually be narrower in the front now so that it sits higher and doesn't wobble, but rather really lies in its center of gravity so that the entire saddle lies evenly. And it just doesn't do that right now. That's fine. What I see now, he is 5 years old, and I think Miss Frywald wants the absolute best for him. And it is just that the center of gravity where you sit in the saddle, well, you are basically sitting with your sit bones back here. If I follow the last rib up now, it is pretty much exactly. Thoracic vertebrae, 18, 17, 18. And that would be, biomechanically speaking, already too far back. You should actually always try for, well, 14 is almost never possible, but 15, 16, that is something you should really aim for. And that is actually doable with a dressage saddle. Yes, before I move on to the hindquarters, we have a pelvic tilt and also a high position of the rear left pelvis. Although it is always questionable, is the right side too low or the left side too high? And I am just going to look at that in motion now. That means I will take him out on the lunge line first, see what happens, and look at the whole movement dynamics. And then, if it is still necessary, I will correct the pelvis. So what you feel here in the fight is a small split. Let's see if it is on the other side too. So it is not on this side. So that is a bit misleading, of course, because it feels like the tendon is a bit swollen here, but I do not think that is the case. It is really because the splint is just pushing the tissue up a bit, so it feels a bit strange here. The tendon is very clear. There is no lump in there, no small nodules, so that is good. The hooves are also even in terms of temperature. The back right's a bit worn. That could also be from taking off the shoe, where he surely stepped on it heavily before. Stepped into it, otherwise it wouldn't have been twisted. So I am actually testing everything today. That means I have looked now. He is high in the back left. The question is he high in the back left or low in the back right? I am going to try that out in motion now.
He's actually very, very soft in the mouth for riding. Very soft.
Yes.
And that is why I chose that bridle, because I believe that center bits in a gentle hand are more comfortable for the horse than those thick chunks.
And he does very well with it too.
Yeah, well, I always find thin bits much better than the big ones anyway. Oh God.
Need sharp pieces?
No, well, no. Well, I'd say no. It's not sharp if you hold it very gently and finely in your hand. So I also always have very thin bits.
Yes.
What I've really moved away from by now is double jointed.
Really?
Yes.
Yes.
You can also test that quite nicely. Horses that have a very wide mouth, they actually get along well with it. Such cute little muzzles. You see that quite often. You don't even have to take the rein very hard for that.
On one side, is that so?
That really, this part here, the moving part, goes over the bars.
Yes.
And if you then just take a tiny bit on the inside, on the outside, these bars here get pinched.
Yes.
And that's why I've actually always used single jointed thin, but single jointed. Because I don't want to have that. Basically,
Right?
you can see that quite well when they're actually bridled and you lift the lips up.
Right.
Then you can see where is this part located. So that would always be doable if this middle piece were much, much smaller. Just such a tiny little thing. But because
That reduces the leverage, doesn't it?
exactly, yes. Because they're always so big, it's the case with almost all the horses that have been here that it's really this nutcracker effect.
Okay. Yeah, I have enough bits at home. I'm happy to bring another one. From earlier years, from I don't know when they came out, 20 years ago or so, they didn't even exist before that.
Training bit. It was for young horses then.
Right? And back then, for normal riding, you only got single jointed ones or they didn't exist at all.
It's okay, it's okay, it's okay. Good girl, good girl, good girl. You're doing great. Yes, yes, yes. Stay here. Stay here. Stay here. Stay here. Over there, it's the end back there. It's the end. It's the end. It's the end. Come forward again. Come back. Yes, come here. Good girl. Well gone. Look here. Come here. Would you like this with it? Tastes much better than that, right?
I'm a fan of that too, always having pockets full of treats. I've always had good experiences with doing that. You can't really bribe horses. That's just a fact. But small gifts keep the friendship alive. It always depends on the intention with which you give them. And that's also, you can't magic away nervousness or fear with a treat, but you can create friendship or at least support it, right? And the sense of taste is a very important one, so that you also feel comfortable and
Well, our three now, they really, I have to be careful. I just have to take the bit in my hand and then they're already mouthing for it.
usually they unfortunately have the noseband in their mouth because they know exactly, oh, here comes the bit and it's tasty.
Yeah, and he's right. Totally relaxed in reality, the way he's walking around.
So what I find quite pleasant is that, well, it's very, very rare. This noseband buckle, the simple one, all the new bridles, they have these Swedish buckles where you pull it around first through a pulley. And you often find that horses are already crooked beforehand to one side because when you pull it around and back again, you always have this tendency that the pressure really already goes in one direction. You don't have that here, of course.
I couldn't have explained it that well, of course, but I like it when they're just very soft, the bridles, because these stiff, thick straps on the nose and on the nasal bone, there's only so little skin over it and so many nerves. And I usually ride with a good 4 fingers that I can fit under there. And I've never had a problem with the horse that not
On the contrary,
getting there.
no, I always have it very, very loose too.
Exactly. That doesn't work with these thick things. If you pull them through twice, you get a stiff bulge in the back. That just doesn't work. I searched for a long time because there aren't many of those anymore, but we took the softest one that we could find.
Well, I always have them super loose. Just like the flash strap, theoretically speaking, they're not even on for me,
Yeah, not for me either.
but they are on there.
Look, this is a Culcus halter here. No flash strap, no.
Flash strap? You're not supposed to tie them shut. But I do find it really helpful if you really have a tricky situation and really have to take hold. And they can't open their mouth indefinitely. It's more of a safety thing for me. Well, that's nice. Please don't freak out until I have my gloves on. I think he's afraid of water. That's really nice. Good boy. You did so well. I'm proud of you. Yeah, good boy. Great. That's nice. Great. Perfect. Excellent. Yeah. Tim. One. Good. Stay out here. Stay out here. Stay out here. That's a good boy. Stay out here. Good boy. So what I'd really like now is for him to yield here at the inner snaffle ring and come toward me. Good boy. It's difficult, of course, down there where Campino is running. He really wants to look over there. Here, and here. There. Here. Here. Over here. Good boy. And I also want him to look for the way down deep on the snaffle bit. Great job. That's all very exciting, isn't it? Yeah, super. You're doing a great job. Here, come on over here. There you go. Excellent. Stay out here. That's a good boy. Stay out here. Here. So I'm going to make this circle a bit smaller and see if he can maintain that.
It's his first time here in the arena.
Yes.
Super.
Great. Good boy. So, and what I'm ultimately looking at now is correcting his crookedness a little bit as well. So that he really bends out a bit from the shoulder here. Boom. That was so well done. Great job. Perfect. Excellent. Stay out. Whoa. Stay out. You're here. Stay out here. Super. Great job. That's a good boy. Come over here a little bit. So, and what you can actually see quite nicely now is that he's not swinging his hindquarters out at all. When I bring him around here in the front, I have to flick him out a little bit there so that he really changes his footfall to the other leg, making sure to fully shift his weight over. Good boy. That's a good boy. So, that's really good. And WAAL. Great job. Keep it up. So what I just noticed is that although he brings his head around, he doesn't take any weight on the front inside, but rather always pushes his hindquarters in and walks in a sort of half pass position.
Yeah, those were the last lessons that were ridden with him there in that stable, right?
Okay. Yes, good.
That looks good, of course. If a young horse can already do that. With me, he doesn't have to be able to do that yet.
And also fits with his pelvis.
Yeah.
Right? Yeah. So, and now I've just pushed him out a little bit.
Yeah.
And then he does it too.
Yeah. You have a whole rider's life to learn and practice that with him.
Yeah. Such a really cool guy. Also here that you're handling the lines around here. So this side here, nice and easy, read it? Yes, now let's take a look at this side. Very nice. Great. Excellent. So what I always want is for the horses to simply give to the inside rein and carry themselves. Right, so that I don't have to tell them with every step. And that they also, let's say in the shoulder area, behind the shoulder blade, bend a little bit so that they carry themselves in self-carriage. He already did that really nicely there during the last laps. So let's see how this side looks, what your knee has to say about it. That's nice. And up we go. So just warm up a bit here first. Exactly. Just do it normally at first. Yes.
I'm more exciting here at the fence than the wooden horse.
Yes. So, right, because he's bending, well, for me, he's bending up there now. He's also offering to go deep, but the pole isn't relaxed.
It's not as honest as they say, right?
Exactly.
A little tense.
I always call that a posture learned by heart.
Wow.
That's nice. Like that. Exactly. Now let's see what we need to do. So ultimately, I'm always testing out what the horse reacts to. Some I have to tap out at the shoulder, some at the hindquarters. So, and he's actually staying too straight in the shoulder for me now. That means, theoretically speaking, he's running to the left and only going to the right for my sake, because I'm doing something here. So, now I'll bring him in a bit tighter. Fine. So, look. Now let's see, right? What happens? So nice. Yes. So nice. Get your butt out. Get your butt out. Out there. Was. Why?
He also has a very slight laryngeal paralysis on the left side, right?
Okay. Mm-hmm.
So when he was being ridden properly in a balanced and upright canter, you could really see the difference.
Yes.
You could hear it too.
Okay.
Huh?
Was it?
It checked endoscopically during the major vet check, and I think, as far as we can tell, it doesn't cause him any problems if you don't turn him into a high-performance sport horse.
Yes.
That might come
when he's older, right?
Yes.
So.
But of course, I don't know if that's also with the bending then, when he's supposed to bend in the front. It could be that also,
at least in an upright position, you know, in a collected frame. So.
But you said earlier, those really learned postures, yes, it was naturally the case that he was presented like that. Where you really noticed, I mean, these horses that are for sale, they just have to show that and do it that way already. And the whole thing is still a bit artificial. And now I should just be allowed to be a horse for that. Be allowed to work really well and honestly, so that it also makes sense for him.
So, but what you can see is he has a fantastic walk.
Yes.
Right. And he also steps very cleanly into a track. He doesn't step past his front hooves now, not even in this tight circle. He steps exactly over. So he's not stepping to the left or right of the track now. So, and here he's just hanging on the inner rein. And I've already taught my big contrad traverses, shouldering, and everything in the first 8 weeks. Where a lot of people just complain way too early. But he's 180 meters at the withers. And an arena like this is quite small when he trots. And if they don't know what to do with their legs, then you really have a problem. And then I taught him all the lateral movements there are at a walk in the first few weeks. And only then did I start trotting. And then there was no problem anymore. Fine. Well done. So watch what I want from you. Yeah, just one lap. Yeah, that's nice. But out here. That. Not like that. That's nice. Great. You're doing great. Excellent. So I just want to see what happens when we start to canter. Canter. Up. Up. Now, Pen, get her. Up. Up. Yes, I just want to see what happens with your knee. Hup. So exactly that. That's how you should go now. So, and stay here. Good boy. Look at that. Look, then it's much easier.
I mean, yeah, you can just see that he's still young. I think he's always afraid that he doesn't have enough room for his canter.
Yes.
And then it's good if you give him a little bit of time.
By accident. Yes, fine. Good. Oh, good. Let's do it again. Everything's fine. Fine. Super. Canter. Hup. Fine. Well done. Fine. Great. Well done. Yeah, it's hard for him without being held together, right?
Yes.
To balance himself.
They both did great because the right hand is his good side. He finds it easier there.
Uh-huh.
On the left, bending and everything is a bit more difficult.
That's nice. Well, we have something to work on. Super. Look, now we're going to do something completely new. Let's see what you say to that, huh? Yes, I'm going to walk a bit more with Bourbon on the cross trail. Vicky is coming with us. And I'd really like to know what he thinks of the water. Because I'd really like to do that in the future. Just for his knee, for his hindquarters, so that he really goes through there. If he does it on his own, that would be great, of course. Otherwise, I'd just try it as a lead horse with Conrad. But now he has to walk a bit more anyway. Great. Good boy. You're doing excellent. Great. Great. Super. Oh, how exciting is this, right? Yeah. Hello. There's a flag. Cool, right? Is that great? Come on, let's go over to where Campino is. You don't have to go in. You can just take a lick. Look, have a lick. Oh, Bourbon. You're really something else. Look, there's a boat over there. Stay here. That's nice. Right? He has to get to know the whole route once. And it's just so great there, right? And it's really beautiful. Campino left. He's getting more restless now, you can tell. He's even walking past me. That's leading training, but he didn't get mean or rear up, buck, or anything like that. Good boy. Super. Yeah, Bourbon did a really great job. He also ran well on the lunge line. I've noticed a bit of a situation where cantering to the left is very difficult for him, but even that can be trained really nicely. It's nice that there are actually still things that we can work on. He stepped right into the water. I don't think he even really noticed it. Yeah, and going up and down hills, I think that's really good for him because he gets balance and learns to use his four legs. Yeah, where he got a bit suspicious was when Campino said goodbye. He didn't like that much, but he stayed with me anyway. He doesn't know the terrain back there at all. There's actually a rowboat right there on the edge. Usually all horses look at it, but he wasn't interested at all. The only thing I've noticed now, I think it just gets neglected in large facilities, is this leading training, and I'm going to do that properly with him soon. You did a good job. Really good. Super. I always like to do it through muscle pulls and not through manipulation, which for others is adjustment. I don't think much of that either. We can take a look ourselves. Yes.
That's nice. It's straight at the top now, but it's still forward. And so, the pelvic blades, one is still forward and one is back.
That's true. We have a bit of a slope here.
It's nice and straight at the top.
So.
But it's really, unbelievable, this difference here on the side.
Yeah.
So it wasn't at all during the rotation with the kneecap, but when he shifts weight from left to right while famming, that it cracks.
Now, let's just see what happens when we go here. Go there. Back over there. Yes, indeed. Well done. Great. Super. Come back over here. There it is. When he relieves this leg. There's a click up in the knee. That's it. Well done. Great. You're doing well. There you go. That's nice. Oh, it's cracking here, huh? Something's cracking. Tell me. Here it's cracking, right? Yes. 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 He did that well. Come here. Yes, come here. Ah, you see? Now something's happening, right? So I can't pull the leg out to the back. I'd be a bit worried about getting problems with the kneecap. That's why I have to try it through muscles and through fascia. To simply move the pelvis. Good boy. So fine. Yes, so fine. Here. Stay still. I know it's uncomfortable. Right. You should already know this from Vicky. She also stood on the stool. When I say that you should lead forward,
yes,
then just start leading forward.
Uh-huh.
So now just start walking.
How far?
Just walk. So fine. So it's still not quite there, but at least it's already round. But this one is still higher. Then I'm curious to see how it looks in a week. Now he's standing very, very cleanly. That's naturally more pleasant right away, right? He's cooperating nicely. You're such a good boy. Without the shell, and you can really feel it if both of them are exactly the same.
Yeah, that's significantly better than before.
Or forward.
That's what you can now. The height is still a bit different, of course, but otherwise, the angle of the tilt feels the same.
Exactly. And sometimes it's like that if one got stuck on the stall door or something like that. Then the half where he bumps is either pushed back or maybe even tilted back. So upright, as we humans would say. Now, right? And that's not the case now. And if you really put your fingers on top of put them on the tips and point your thumbs up and look from behind. Then you can also see if it's evenly high. That's why you can always check for yourself when you have that back there. Of course, you just have to be careful not to have one hand flat and one hand high.
That's tricky. So here, exactly, this is the upper crust. If I put him here now, we're like this, right?
Then of course you still need to know if you have a longer thumb. So there's, I think, quite a bit that we can work on. Also just that he gets strength in his hindquarters, which we need again for his patella, for his patellar tendon. I would actually work on that with the double lunge first, right? So that he really
Copes with his own weight for once, without someone also sitting on him, right?
Yeah.
Like me, I'm not always in balance either.
So, and what it's always very, very simple for the horses in the end. I see that quite often. Those who are used to a lot of rein contact. So, and if he's had a classical training, then it's often the case that they're just also, because they're young, unbalanced. Right. They just get a lot of rein contact. If forward and down is naturally missing in the training, then they don't learn at all to carry themselves or to balance themselves without reins. So, and then you actually take over that part. So, and if you're really a professional rider, then you have completely different strength ratios. Then you have, well, they don't feel it anymore that they really have their legs closed because that's normal for them. If we sit on there now and think, oh, what's this? That's nothing to them. Right, so, and then they're actually being held. And that's the impression I actually had with him. When starting the canter, that he's been held in front, and that's why he can maybe start the canter in a collected way, but not on his own without this help, right? Because he doesn't really give the impression right now that he can balance himself very well. So, right, but he did that really well in the trot then. You just have to give him the chance to try it out.
Oh, how sweet is that? Such a good boy.
But, well, he's really a good boy.
Yeah.
Such a good boy.